Welcome back to Intimacy Unveiled: Understanding and Overcoming Sexual Dysfunctions in Marriage, on Dr. Irene Ance's channel. In Chapter 1, we delved into the significance of sexual health in marriage and the importance of breaking down stigmas and misconceptions. Today, we're stepping into Chapter 2, where we shine a light on a specific aspect of sexual health: delayed ejaculation. Delayed ejaculation, also known as inhibited ejaculation, is a common sexual dysfunction that can affect individuals and their relationships. In this chapter, we'll take a closer look at what it is, what causes it, and explore strategies for overcoming this challenge. We'll also delve into the critical role of communication and support in the relationship as we address this issue. So, if you or your partner have ever faced the frustration of delayed ejaculation, or if you simply want to understand this topic better, you're in the right place. Let's get started on this enlightening journey into Chapter 2 of Intimacy Unveiled. Sexual dysfunction refers to a broad category of issues or challenges that can affect an individual's ability to engage in a satisfying sexual relationship. These difficulties can manifest in various ways and can impact both men and women. Sexual dysfunction can encompass a range of concerns, including delayed ejaculation, also known as inhibited ejaculation, is a sexual dysfunction that primarily affects men. It is characterized by a persistent difficulty or inability to achieve ejaculation and orgasm, even with sufficient sexual stimulation and desire. In cases of delayed ejaculation, a man may engage in sexual activity for an extended period without reaching climax, or he may be unable to ejaculate at all. Delayed ejaculation can manifest in various ways. Situational delayed ejaculation. In some cases, the delay may only occur in specific situations or with certain partners, while it may not be an issue in others. Generalized delayed ejaculation. In more severe cases, delayed ejaculation can be a consistent and generalized problem, occurring in all sexual encounters. The causes of delayed ejaculation can be diverse and may include psychological factors. Anxiety, stress, relationship issues, or performance anxiety can contribute to delayed ejaculation. Past traumatic experiences or upbringing can also be factors. Medical conditions. Some medical conditions, such as neurological disorders, hormonal imbalances, prostate issues, or certain medications, can lead to delayed ejaculation. Age. Delayed ejaculation may become more common as men age, although it can affect men of all ages. Lifestyle factors. Substance use, particularly excessive alcohol or drug consumption, can affect sexual function and contribute to delayed ejaculation. Treatment for delayed ejaculation depends on the underlying cause. It may include psychotherapy, such as cognitive behavioral therapy, to address psychological factors. In cases of medical or hormonal issues, addressing the underlying condition may alleviate the problem. Sometimes, medication or other interventions may be recommended to help facilitate ejaculation. It's important to remember that delayed ejaculation is a treatable condition, and individuals experiencing it should seek the guidance of a healthcare provider or a therapist who specializes in sexual health. Open communication with one's partner is also crucial in addressing and managing this issue. Delayed ejaculation, or inhibited ejaculation, can be caused by a variety of factors, which may be both physical and psychological in nature. Understanding the underlying causes is essential for effectively addressing this sexual dysfunction. Here are some of the common causes of delayed ejaculation. Psychological factors. Anxiety and stress. High levels of anxiety or stress can inhibit sexual arousal and the ability to reach climax. Performance anxiety. Worrying about one's sexual performance and the pressure to satisfy a partner can lead to delayed ejaculation. Relationship issues. Conflicts or dissatisfaction within the relationship can affect sexual function. Past trauma or conditioning. Previous traumatic experiences or upbringing that instilled negative attitudes or beliefs about sex can contribute to this condition. Medical conditions. Neurological disorders. Conditions such as multiple sclerosis, spinal cord injuries, or diabetic neuropathy can affect the nerves involved in ejaculation. Hormonal imbalances. Imbalances in hormone levels, particularly low testosterone, can lead to difficulties with ejaculation. Prostate problems. Enlarged prostate or surgical interventions involving the prostate may affect ejaculation. Medications. Some medications, including certain antidepressants and antipsychotics, can have side effects that delay ejaculation. Age. Delayed ejaculation may become more common with age, as the body's physiological responses change over time. Lifestyle factors. Substance use. Excessive alcohol consumption and illicit drug use can impair sexual function and contribute to delayed ejaculation. Sexual habits and masturbation techniques. Some individuals may have developed habits or techniques during masturbation that are different from partnered sexual activity, making it difficult to achieve climax during intercourse. It's important to note that the specific cause of delayed ejaculation may vary from one individual to another. In some cases, there may be a combination of factors contributing to the condition. Treatment for delayed ejaculation depends on the underlying cause. It may include psychotherapy, such as cognitive behavioral therapy or sex therapy, to address psychological factors. In cases of medical or hormonal issues, treating the underlying condition may resolve the problem. Sometimes, medication or other interventions may be recommended to help facilitate ejaculation. Open communication with a healthcare provider or therapist who specializes in sexual health is crucial for identifying the cause and developing an effective treatment plan. Additionally, involving one's partner in the treatment process and addressing any relationship issues can be an important part of overcoming delayed ejaculation. Overcoming delayed ejaculation, also known as inhibited ejaculation, can be achieved through various strategies. The approach to addressing this challenge may involve both the individual experiencing it and their partner. Here are some strategies to consider. Psychotherapy and counseling. Sex therapy. A qualified sex therapist can help individuals and couples explore the psychological factors contributing to delayed ejaculation. This may involve addressing performance anxiety, past trauma, or relationship issues. Cognitive behavioral therapy, CBT. CBT can be effective in managing anxiety or negative thought patterns that hinder sexual performance. Communication and emotional connection. Open and honest communication with a partner is essential. Discussing desires, concerns, and expectations can reduce anxiety and create a supportive environment. Building emotional intimacy and trust can help ease the psychological barriers that contribute to delayed ejaculation. Behavioral techniques. Sensate focus. This technique involves exploring each other's bodies in a non-sexual manner to reduce performance anxiety and improve overall comfort with physical intimacy. Kegel exercises. These exercises can help improve control over ejaculation by strengthening pelvic floor muscles. Medications. In some cases, certain medications may be prescribed to help manage delayed ejaculation. These medications, such as antidepressants, may be used off-label for this purpose. However, they should only be used under the guidance of a healthcare provider. Lifestyle changes. Reducing substance use, particularly alcohol and recreational drugs, can have a positive impact on sexual function. Prioritizing overall health, including regular exercise, a balanced diet, and stress management, can support improved sexual health. Reducing pressure and performance expectations. Reducing the pressure to perform and focusing on the connection and pleasure with a partner can alleviate performance anxiety and create a more relaxed environment. Sensate time and spontaneity. Allow for spontaneity in sexual encounters rather than adhering to a strict schedule. This can help reduce performance pressure. Use of desensitizing agents. Some individuals find relief from delayed ejaculation through the use of desensitizing agents, such as topical creams or sprays. However, their use should be discussed with a healthcare provider. Seeking professional guidance. If the issue persists, or if there are concerns about underlying medical conditions, consulting a healthcare provider who specializes in sexual health is recommended. It's important to approach the issue of delayed ejaculation with patience and a willingness to explore solutions. Strategies may vary from person to person, and it may take time to find the most effective approach. Involving a qualified healthcare provider or therapist can provide guidance tailored to individual needs and circumstances. Additionally, involving one's partner in the process and maintaining open communication is essential for a successful journey toward overcoming delayed ejaculation. The critical role of communication and support within a relationship is pivotal when addressing the issue of delayed ejaculation or any sexual dysfunction. Here's an in-depth exploration of why communication and support are essential. Open and honest communication. Open dialogue between partners is fundamental. Both individuals need to feel comfortable discussing their feelings, desires, and concerns related to delayed ejaculation. Open communication creates an environment of trust and understanding. Reducing anxiety and performance pressure. The anxiety and performance pressure associated with delayed ejaculation can be alleviated through communication. Partners can express their understanding and support, reassuring each other that the focus is on intimacy and emotional connection rather than performance. Emotional support. Offering emotional support to a partner experiencing delayed ejaculation is crucial. This can include empathetic listening, reassurance, and validating their feelings and experiences. Joint problem solving. Couples can work together to address the issue. Joint problem solving, such as discussing potential strategies and solutions, can make both partners feel involved and empowered. Creating a safe space. A supportive environment in which both partners can express their feelings without fear of judgment is essential. This safety allows for vulnerability and a deeper emotional connection. Managing frustration. Frustration is a common reaction to sexual dysfunction. Partners should be prepared to manage and cope with this frustration together. They can explore other avenues for intimacy and pleasure while addressing the issue. Seeking professional help together. Sometimes, the best course of action is to seek professional guidance as a couple. Consulting a sex therapist or counselor can provide expert support and guidance while involving both partners in the treatment process. Maintaining intimacy. Partners should focus on maintaining intimacy and connection outside of sexual activity. Engaging in non-sexual affection, quality time, and emotional connection can help reinforce the bond between partners. Patience and understanding. Patience is key. Both partners should understand that overcoming delayed ejaculation may take time and effort. It's essential not to rush the process or become frustrated with each other. Mutual desire for improvement. Both partners should share a mutual desire to address and improve the situation. This shared commitment can provide the motivation needed to work together effectively. Healthy sexual exploration. Couples can engage in healthy sexual exploration, trying new things and techniques, to overcome the challenges posed by delayed ejaculation. This can lead to increased satisfaction and enjoyment. Overall, the role of communication and support in addressing delayed ejaculation cannot be overstated. The challenge of delayed ejaculation affects both partners, and addressing it as a team can lead to a stronger and more fulfilling relationship. When communication and support are at the forefront, couples can work through this issue with empathy and understanding, ultimately enhancing their emotional and sexual connection. Thank you for joining us in Chapter 2 of Intimacy Unveiled: Understanding and Overcoming Sexual Dysfunctions in Marriage, on Dr. Irene Ance's channel. In this chapter, we embarked on a journey into the world of delayed ejaculation, a common sexual dysfunction that affects many men and their relationships. We delved into the causes and explored a range of strategies to overcome this challenge. But at the heart of it all lies the power of communication and support within a relationship. We emphasized how open and honest dialogue between partners is essential, reducing anxiety, and fostering understanding and trust. As we conclude Chapter 2, it's important to remember that addressing delayed ejaculation is a shared journey. The road to overcoming this challenge requires patience, empathy, and a commitment to mutual satisfaction and emotional connection. Together, couples can navigate this issue and strengthen their bond. So, please stay tuned and keep the conversation going. Hit that subscribe button. Give us a thumbs up if you found this information valuable, and ring the notification bell. Join us in Chapter 3 as we explore another facet of sexual health in marriage. Your journey to a healthier and more satisfying marital relationship continues right here. Until next time, take care, and remember that you're not alone on this path to a more fulfilling relationship.